Hi, Dr. Vo here. In today's video, I'm going to be going over the postoperative instructions I provide my patients after having cataract surgery. This is meant to be a general guideline and should not substitute or replace the specific instructions provided by your eye surgeon. You will usually go home with 3 types of eye drops. Here's how to use them. The first is an antibiotic drop. This is to prevent infection. Typically, it will be either moxifloxacin or ofloxacin, which has a tan-colored cap. Use 1 drop in the operated eye 4 times a day for 1 week. The second drop is a steroid drop. This is to reduce swelling and inflammation. Typically, you'll receive either prednisolone or difluprednate. These will usually have a pink or white color cap. Use 1 drop 4 times a day for 1 week. You will then need to taper the eye drops. At week 2, you'll go down to 1 drop 3 times a day. At week 3, you'll go down to 1 drop 2 times a day. And then at week 4, once daily. The third drop is a non-steroidal anti-inflammatory drop, which is also used to reduce swelling and inflammation. This will typically be either Cataract or Bromfenac, which has a gray color cap. Use 1 drop once daily for 4 weeks if you receive Bromfenac, or 1 drop 4 times daily for 4 weeks if you receive Cataract. Now, some general precautions. Please wait 5 minutes between drops. Make sure to always wash your hands before handling your eye drops. Don't touch the dropper tip to your eye as you may contaminate the bottle. After surgery, please avoid the following. Number 1, no touching or rubbing the eye. Sutures are not typically used during cataract surgery, so rubbing your eyes can potentially open the incision made. Number 2, no heavy lifting, bending over, or straining for 1 week. Number 3, no swimming, hot tubs, or getting water in the eye for 2 weeks. Shower from the neck down for 1 week. Number 4, avoid dusty or dirty environments. So what can you do after cataract surgery? It's okay to do light activity like walking, reading, or watching TV, even if right after surgery. Please make sure to wear your protective eye shield while sleeping for 1 week. If you're going outside, wear sunglasses to reduce light sensitivity and to protect your eyes from wind and dust. After surgery, you may experience slight blurriness or glare, a gritty or scratchy feeling, mild redness or tearing. All of these are common and normal symptoms and should improve over the first few days. However, please call your surgeon if you experience the following: sudden vision loss, severe pain, increasing redness or discharge, or flashing lights or a shadow in your vision. Hopefully you found this video helpful. If you did, please make sure to like and subscribe. If you'd like to watch my complete guide to cataract surgery, please click the video card on the screen. I'll see you in the next video. Bye!